Good morning. We're going to talk about eosinophil biology in COPD. Here's the expositor of the topic, and we're going to refer some of the subtitles of this topic. First of all, in definitions of what is an eosinophil, what is COPD, how eosinophil and COPD are related, and the issues of the topic itself. Now, we're going to talk about what is COPD. So, COPD is a chronic obstructive pulmonary disease. It's a lethal disease that is predicted to become the third leading cause of death globally within 3 years. Chronic bronchitis and emphysema are no longer used, but are now included within the COPD diagnosis. COPD is not as simply a smoker's cough, but an underdiagnosed, life-threatening lung disease. A COPD diagnosis is confirmed by a simple test called spirometry, which measures how deeply a person can breathe and how fast air can move into and out of the lungs. Such a diagnosis should be considered in any patient who has symptoms of cough, sputum production, or dyspnea that is a difficult or labored breathing, and or a history of exposure to risk factors for the disease.
Hello, in this health sketch we want to talk to you about COPD. COPD stands for chronic obstructive pulmonary disease. It's a bit of a mouthful, but it makes sense when you break it down. Chronic describes how it doesn't go away. Obstructive describes the way it makes breathing difficult. And pulmonary disease means it affects the lungs. Around the world, COPD is becoming more common. It's now the third highest cause of all deaths. The COPD, as particles from tobacco smoke inflame and irritate the lungs. So stopping smoking is the best thing smokers can do. However, COPD does occur in non-smokers too. Polluted environments and rare genetic diseases can also lead to the disease. But what exactly is COPD? First, let's see how the lungs work. The lungs are a spongy network of airways and air sacs. When we breathe in, air travels down branching airways, which become smaller and smaller, ending up in tiny air sacs. In these air sacs, oxygen from the air moves into the blood, and carbon dioxide moves out. In COPD, inflammation over time causes permanent damage to the airways and air sacs of the lungs. The airways become inflamed, swollen, and filled with mucus, obstructing the flow of air. The air sacs lose their structure and sponginess, so they can't fill and empty as easily, making the exchange of oxygen and carbon dioxide difficult. These lung changes cause the key symptoms of COPD: breathlessness, wheeze, cough, and phlegm. You should see your doctor if you have these symptoms, as early treatment of COPD can make a big difference. Doctors can arrange breathing tests to see how hard and how fast you can blow out air from your lungs.
So, what is an eosinophil? The eosinophil is a fully delineated granulocyte type of white cell that disseminates throughout the bloodstream to end organs after complete maturation in the bone marrow. While the presence of eosinophils is not uncommon, even in healthy individuals, these granulocytes play a central role in inflammation and allergic processes. Eosinophils confer a beneficial effect on the host by enhancing immunity against molds and viruses. However, tissue-specific elevation of eosinophils, particularly in the respiratory system, can cause a variety of short-term symptoms and may lead to long-term sequelae. Eosinophils often play a role in more commonly encountered disease processes, such as asthma and allergic responses in the upper respiratory tract.
Hello, I bring greetings to all of you from Christian Medical College, Vellore. I will start with the scenario. Here is a 38-year-old male patient with past history of asthma and allergic rhinitis for 8 years. Lately, over last few months, his asthma has not been under good control. Kept up, the dose of inhaled corticosteroids were increased, but still his asthma was not under control, and he ended up having frequent courses of oral steroids for exacerbations. And these exacerbations recur again after some time. The spirometry was done, which showed persistent obstruction. He also developed a skin rash with some ulcerations. And now lately he has developed systemic symptoms like fever, malaise, weight loss. He was detected to have new onset of hypertension, and on further probing he has numbness of hands and legs. So clearly something more is happening more than his asthma or allergic rhinitis. So he was further evaluated. A blood count was done which showed normocytic normochromic anemia, and what was striking is peripheral eosinophilia with WBC counts of 15,800 with 30% eosinophils. Urine showed microscopic hematuria. So this
Eosinophil and COPD biology. So there was a hypothesis that established that eosinophil cells were found not only in the bloodstream but also at the respiratory airways and gastrointestinal tract. And it was said that these cells only react to inflammation of these organs. Some circumstances such as asthma or pneumonitis, but nowadays it's said that eosinophils are not or aren't only found at the specific disease, but also at chronic problems such as COPD, representing one of the reasons of why people cannot cure completely, and using alternative treatments to stop eosinophils result beneficial at the lung inflammation. Inflammatory pathways implicating neutrophils have been emphasized, but attention has recently focused on the persistent blood and airway eosinophilia that is found up to 40% of patients with COPD. Even in the absence of a history of asthma, such patients have a higher risk of exacerbations than patients without eosinophilia. I can say at the study that pros and cons of this topic represent understanding that smokers are not the only people that can develop COPD, evaluating other allergic conditions that are related to eosinophils to prevent COPD, new medical treatments that may enhance your life quality and avoid a chronic disease, being informed by blood tests if you are in or out of a respiratory tract condition, and the cons is that everybody will need to expend a lot of money in health, even not being smokers. Air pollution is still a matter that can be avoided from a country, and future youngsters will need extra care in its lifestyle.
Of diseases that cause airflow blockage and breathing-related problems. It includes emphysema, chronic bronchitis, and in some cases asthma. It reports that COPD is the third leading cause of death in the United States, claiming more than 120,000 American lives each year. More than 80 and don't know it. According to the Centers for Disease Control and Prevention, in the United States, tobacco smoke is a key factor in the development and progression of COPD, although exposure to air pollutants in the home and workplace, genetic factors, and respiratory infections also play a role. In addition to avoiding tobacco smoke, many properties have conditions or indoor air quality pollutants, irritants, and allergens that may aggravate COPD in people with the condition. These may include dust mites, pet dander, mold and bacteria, pollen, scented soaps, shampoos, and perfumes, fumes from cleaning and other chemicals, dry cleaning chemicals, smoke from fireplaces and wood stoves, dusty conditions, dirty HVAC ducts, dirty carpeting, and outdoor pollution that infiltrates a property. COPD, avoid exposure, detect to learn.
Chronic obstructive pulmonary disease, or COPD, it's the third leading cause of death in the U.S. For those who So we hear about stem cell therapy often, but what exactly does it do?
Well, we can use the example of cutting your finger to kind of illustrate, because when you cut your finger, there are damaged cells that release chemicals called growth factors. And these growth factors call in cells to clean up the damage. And then stem cells, which are the cells that come in, actually multiply and lay down the new tissue. So all this healing done in our body is really done by stem cells. So when we're doing stem cell therapy, what we're doing is we're taking stem cells from your fat, your own cells, and then delivering it where your body doesn't do it well or doesn't do it at all.
What kind of problems are we helping with this stem cell therapy?
Well, we're helping a long list, but in particular this morning we want to talk about lung disease, or COPD, because it's not had historically a treatment that could do anything about the underlying lung function.
And is that the problems that Ron had?
That's exactly what Ron had. So,
Dr. Bill Johnson, and the stem cell therapy, what was life like?
So there is percentage that demonstrate the limitations that have people at works. It says that it affects household chores and former activities. It refers to the ability to work volunteer, needed help at any time, and receive help in prior months. It is said that having COPD reflects the limitation of the activities itself. So some people are unable to work with this disease. And referring to an issue in Ecuador is that at the current time COPD is very common at detention services, and its previous studies issues were related of prescribing treatments that weren't necessary for certain type of patients, such as the corticosteroids. It's still an issue because the smokers never release their habits, and because of its association with disease as tuberculosis and lung cancer that denies from using measures of treatments. As a conclusion, we may say that the needs of studying COPD as a common condition in adults may be updated because of new lineage of treatments, and also because of the updates of pathophysiology and factors related to the disease, such as eosinophils. This measure can help to come out with other treatments related to inflammation rather than just improve respiratory condition, and could in the future make COPD less chronic than how it is nowadays.